Did pasta give me kidney stones? Let's talk about that. It's not an ingredient. Like sometimes we'll
Right.
talk about specific ingredients, but it is an entire category that really encompasses so many different things.
Yep, it's interesting. Well, somebody listening maybe not. No, it's not, but it is. It is interesting. This is, and I wanted to do this because it is common. Jill, I can't eat spaghetti no more. Yes, of course you can. So Harvard studied, now specifically, folks, whole wheat pasta. Whole wheat has more oxalate than refined white pasta. So whole wheat pasta, 1 cup has 46 milligrams of oxalate, and if you're just having the plain pasta, 1 cup has 16.5 milligrams. So a little more, a little less than half, a little more than half, whatever. Shut up, Jeff. Anyway, so whole wheat pasta is higher in oxalate. But does that mean you can't have pasta, whole wheat pasta? Of course you can. You could say, but I don't want to waste $46 of oxalate. Out of my 100 in my bank account, I don't want to waste $46 of oxalate on whole wheat pasta. I'm just going to have the regular pasta for only 16. You can do that. But the bigger picture is, too, have pasta, folks. Most of you are not only eating 1 cup of pasta. They may do that in Italy, but we here in America, we eat probably 2 or 3 cups of pasta as a serving. And so pasta, those calories add up. Okay. So I'm looking at pasta. Diabetics can't deal with pasta, too carby. But I think the bigger picture here is not just the oxalate, but how much pasta are you having? If you really wanted some whole wheat pasta, we always are portion not perfection at Kidney Stone Diet. You can have it. I'd also like you to have, maybe you want to put some vegetables in there, especially if you're, trying to eat healthier. It's a great way, even for kids, it's a great way to put some vegetables also into your meal and not just eat whole wheat pasta. There's not a lot of nutrition going on in there. Now, I'm always trying to sneak vegetables onto your plates because most of you are not eating the amount of vegetables that you should each day, which the minimum is 3 cups. So I'll tell people, have your veggies, not a problem. With your pasta, have pasta, put vegetables in it. And if you're having the whole wheat, make sure you're coupling that with calcium, whether it's non-dairy or dairy, and to lower that oxalate. But certainly you can have it. Now, remember, though, if you're having 3 cups, you're having over your $100 of oxalate. So that's going to break your budget. So portion not perfection when it comes to whole wheat pasta. Regular pasta is a lot lower in oxalate. Whenever you eat pasta, I would love for you to put some vegetables in there, red pepper, onion, broccoli. All of these things are lower in oxalate. Please do that. Tomatoes, I know that's a fruit, but you know what I'm saying. Also, remember, sauce will increase your oxalate level, but it doesn't mean you can't have tomato sauce. You can. They studied it. Harvard studied it. Look it up on your list. And we did a lot of shows, Jeff, so I'm getting tired. I'm just saying that.
It's all good.
I'm just saying that. So the bottom line is you can have whole wheat pasta. Watch your portion of it because you may say, Jill, I'm going to have all low oxalate for the rest of my meal. I'd rather have, 1.5 cups. Okay, get some vegetables in there. Have it with some calcium. Not a problem. Don't eat pasta every single day, folks, because that oxalate adds up quickly. Get your calcium needs met. Know that regular pasta is a lot lower than whole wheat pasta. And then you have other pastas like chickpea pasta. You're going to get some protein with that and some fiber. I personally, if I'm having pasta, I don't eat a lot of pasta, even though I'm an Italian woman. I don't because it has the oxalate, and it's just not the healthiest food. I'd rather have other foods than that. If I do have pasta, I always stick vegetables in it because I want some fiber in there. But I use chickpea pasta. Harvard did not study that, but I have a normal portion size. I'm not worried about it. And then I get some fiber and protein to slow that, insulin spike that I may get. So that's my take. Whole wheat spaghetti. Harvard studied it. Almost 50 milligrams for 1 cup. Most of you are not just having 1 cup of pasta. So portion not perfection. Manja.
Yeah. So when it comes to the other goals, so obviously pasta is high in carbs.
Yes.
And there is a sugar goal.
Yes.
Do you connect that at all when you sort of look at it? Okay.
No, but I'm glad that you brought it up because a lot of people will ask that. Sugar, we have a goal on the kidney stone diet of 25 grams of added sugar for women, 38. It's 37.5, but I just give them the extra half. 38 milligrams of added sugar for men. But carbs, we do not count as sugar, so you can have carbs on the kidney stone diet. But for diabetics who are counting carbs or your sugar and carbs, that's your own thing. So we don't have goals for it at the kidney stone diet because that's really not going to affect kidney stones unless there's oxalate in it, or you're just overeating carbs. And obesity, folks, can also increase your kidney stone risk. And so also if you're a diabetic, that can increase your kidney stone risk. So we do not put that as goals specifically to lower your kidney stone risk, but everybody should not be overeating carbs in general, period.
Yeah, and that's a big part, too, is the weight loss with everything because
Yes.
Jill does work private consults with people and also group consults within the All Access Pass at kidneystonediet.com. You actually get access directly to Jill, but you've brought it up before that a lot of that, you start with kidney stones. But then what's next is overall healthy lifestyle, weight loss, diet, or weight gain, but whatever someone needs.
Absolutely. In our group accountability calls, which is part of the All Access membership, there's a lot of people that stay on there. They lose 50 pounds, 70 pounds, 100 pounds in that group, and they stay there because it's so cheap, the membership, and it's a good group accountability. We have it 3 times a week, and it's things like, we're not just talking about kidney stones in there. It's like a little family. So, maybe somebody they're dealing with their mother who's dying and they're not eating enough, or they're overeating, and it's just a place where you could say, look what's going on, guys. I need help going through this phase, and we're there to motivate and support and love. That is a very cherished program for me personally. I just love it because you really get to know people, and that you get to hear wonderful things, and also you just become part of their life, and you share their journey, and you become friends. We're just truly a family in there.
Yeah,
I love our group calls. Love them.
Yeah, a supportive community is so important.
Yes,
especially when we're making major life changes. And this is one. Like, we might think of major life changes as maybe marriage and family and things, but lifestyle is huge because this is our health, and like, we don't want to be in pain anymore.
Yes, and even people in the group, they'll just gain 30 pounds back, and they're like, look, I can't believe that this has happened. That's part of any kind of change. Lots of times we're going 3 steps forward and they were going 14 steps back because life gets in the way of our lifestyles, and we all know that. If you travel a lot, like I said, a lot of us who form kidney stones are at the age where we have parents that are very ill, old, and we're taking care of them, and we still have kids around. It's a really hard, it's a hard time in life, and it's very hard to take care of ourselves when we're going through traumatic times. So that group is really important because it just keeps us on track, and you just don't feel alone. I think it's really important from somebody who's been really sick in their life. It's very easy to feel isolated and alone when you're sick, and, kind of like nobody understands. So that group is as important to me as it is to everybody else in there. Yeah.
Well, I think with that, we'll wrap, and we will see you next week.
Bye, everybody.